Good afternoon, everyone. I'd like to welcome you to this inaugural webinar series, and we're so excited to have you here this afternoon. I'm Al Richmond, Executive Director of Community Campus Partnerships for Health, and I'm based in Raleigh, North Carolina. And we are ecstatic to have you here this afternoon. And I want to share a little bit about Community Campus Partnerships for Health at CCPH. Again, we're a Raleigh-based international nonprofit that has a 25-year stellar history around building partnerships with academic institutions and community partners to address issues around health justice and social equity. And it's a pleasure to be here. I'm joined this afternoon by my colleagues from RTI Research International Institute, as well as the Center for Health Equity and Research at the University of North Carolina, Chapel Hill. Others will be joining us as speakers, and I'll introduce them as they are queued up and ready to present this afternoon. This is such a great opportunity for me as a 1981 graduate of Livingstone College, an historically Black college and university in Salisbury, North Carolina. I want to introduce you to our team, and I'm going to share our slides with you, and that is the CCPH team, and you'll meet our other team members shortly. I'm joined this afternoon by other graduates, alums, and students at HBCUs, and they include Virginia Hunter, who is our Historically Minority Serving Institutions Program Strategist. She's a graduate of Central State University. Trey Mackey, who is a program coordinator with CCPH, is a graduate of Morehouse School of Medicine. And our youngest and burgeoning leader in the field of public health and social justice is Nyla Whitaker, who is a sophomore at Spelman College. You'll meet other team members, including those from RTI shortly. I want to say a little bit about this project in terms of background, in terms of we are launching this initiative with RTI as part of a broader initiative around working with historically minority serving institutions, including historically Black colleges and universities, tribal colleges, as well as Latinx institutions. And the reason why we are launching this initiative with RTI, as well as our broader HMSI work, is because we believe that these institutions sit at the center of their communities. Communities have been disproportionately impacted by health inequities. And we believe that these institutions are the same ones that are going to lead us forward in the days and years to come. They're building upon a stellar, amazing history of over 100 years, in particular our HBCUs in the South and the Mid-Atlantic region. Again, welcome to our session this afternoon, and we will have a number of speakers who will join us and will share about the work of the All of Us Workbench. At this time, I'd like to share with you a poll that we've created, and we're going to bring that poll up. And we want to find out a little bit about you. Before we do the poll, we want to find out about you. So if you could take a moment in the chat box to just chat, which HBCU, if you're affiliated with an HBCU, which HBCU are you with? We see that some have already started. We welcome Dr. Dorothy Brown from Shaw University here in Raleigh, North Carolina. Please share with us where you're from. Or if you're an alum of a historically Black college university, we'd like to hear that. We have Shaw University, North Carolina A&T, Winston-Salem State, North Carolina Central University, Central State University, Fayetteville, FAMU, East Carolina, Morehouse School of Medicine, and others. So please, proud alums, we see that. We want to just give a shout out to you and welcome you to our call today. It's really all about you today as we join with those from Alabama State University, Elizabeth City, and other institutions. We have a poll. Is that poll ready to come up? So we have a pre-poll that we have that you've participated in to find out more about your knowledge around the workbench. And so the question is, how would you describe your knowledge level about the All of Us research academic project? And 24% said very knowledgeable, 20% said somewhat knowledgeable, 16% said a little knowledgeable to no knowledge, and then finally 40% said no knowledge. We hope to increase that over time. Thank you. I want to introduce now our first speaker of the day, Dr. Kareem Watson. Kareem is the Chief Engagement Officer of NIH's All of Us program. He previously had a role of Associate Executive Director of the Miles Square Health Center, a group of federally FQHCs in Chicago affiliated with the University of Illinois Hospital and Health Sciences System. He also served as the Associate Director of Community Outreach and Engagement for the University of Illinois Cancer Center. Dr. Watson has a doctorate in health science, global health, with a concentration in global health, and a master's of science in basic medical research, and a master's in public health. Dr. Watson, we're glad to have you this afternoon. Take it away.
Thank you so much, Al, and thank you to CCPH, and thank you to our partners from RTI. As Al said, my name is Kareem Watson. I'm the Chief Engagement Officer for the NIH, the National Institute of Health, with the All of Us Research Program. Today is really a historical day for us, and we're so excited to be here to have this conversation with you all. We have been able to achieve something unprecedented in the All of Us Research Program, in that just this month, we've achieved over 500,000 participants who have began their journey with us. The goal of the All of Us Research Program is to engage and enroll over 1 million participants in a longitudinal study where we're not seeking to ask one individual question like historical research studies have done. We're not identifying one disease state or one particular type of question that we're trying to ask, but instead we are collecting information from 1 million or more participants over the life course so that we will be able to catalyze research, ask research questions that we have not been able to ask before. And we have an unapologetic effort to ensure intentionality around diversity, equity, and inclusion. And we've been able to achieve that. To date, over 80% of our participants are what we call underrepresented in biomedical research, UBR. And that means also 50% of our participants are underrepresented racial and ethnic minorities. And however you use that term, minority, we acknowledge that different people use that term differently, but this is truly unprecedented. Even as a researcher, I will share this anecdotal story with you before I go on and talk about the importance of you all being here. I'm trained as a cancer disparities researcher, particularly with a focus, I looked at African-American men and their participation in cancer screening, prevention, and control studies. I was discouraged early on in my career from focusing on African-American men because I was told that I would have difficulty, enrolling African-American men in studies because I was told that African-American men were a hard to, quote unquote, hard to reach population. I was also told that I would not likely have data sets that were large enough to really be able to power these studies accordingly to be able to determine some type of statistical difference and really be able to get to interventions and outcomes. And I was discouraged and said I wouldn't get federal funding even to do this work. But I had an amazing mentor, an amazing sponsor, Dr. Robert Wynn, and he encouraged me to do this work, but also gave me the tools and the resources to do this work. And it was because of the support that I have from Dr. Wynn and others that I was able to go on and get R01 study, R01 grant from the NIH, looking at the impact of systemic racism, structural racism, and even other changes in how that impacted African-American men and their smoking habits and the outcomes for lung cancer. But when I think about the data that I did not have, grants that I was not able to get because I didn't have access to that data, I think about the fact that we have 36,740 participants in our database to date that have been diagnosed with, that say they have some cancer. When you think about the size of that, and you think about the fact that this data set also reflects the rich diversity of the US, we have a responsibility to ensure that not the same intentionality that we've had to get the participants to truly reflect the diversity of the US, we have a responsibility to get that same intentionality around the diversity of the research community, those scholars that will be utilizing this data. We owe it to our participants, we owe it to our community to make sure that the messenger matters, that those that are asking the questions also understand the lived experience of the populations that have been enrolled in all of us. Because I'm excited to say when I I met with a recent scholar, and I was proud to tell him that we have 27,160 participants who are African-American men enrolled in our studies. And that is such amazing data to have. I can imagine when I was a postdoc, if I had access to data on 27,000 African-American men, and not just data looking at biological data with these participants, but also that intersectionality is so important. Being able to understand the social determinants of health on those information, because we collect information on social determinants of health. We have access to electronic health record. We can understand how disease changes over time. We have information from the COVID-19 survey, and they'll talk to you more about the data that we have available in the Workbench. But my call to action to you is to really hold us accountable, to ensure that the questions that we're asking, the data that we're collecting, that it's important to you as a researcher, not just to advance your research career, but to begin to truly address health disparities that we see in populations that carry a greater burden of disease, and to really begin to dispel this myth of hard to reach populations. And it's whenever someone tells me populations are hard to reach, I say, well, you're not in the right place. I've never had difficulty enrolling African-American men in the studies in which I've conducted, because I was in the community before the study and I'll be in the community after the study. And that level of trust is something that's so important. So I'm excited today about the role that RTI and CCPH will be playing in allowing us to convene researchers who will get access to this data and to be able to analyze this data and ask questions from this data. I'm also excited about hopefully the way that you'll be able to engage community and make sure that the questions that you're asking from that data has been inspired and informed by community, because that is so important as well. So thank you all for your time today. I look forward to staying and hearing some of the questions, and I thank you to CCPH and RTI for convening such an amazing group of scholars.
Dr. Watson, thank you so much. Quite inspiring, and we're glad to have you and stay on. I want to encourage you to use the chat box to share any questions that you might have or insights in the work that you're doing as well. Our next speaker today, I want to introduce a good friend and colleague who has joined the RTI team, and just bring her slides up here. Dr. Sula Hood is a senior research scientist in the Center for Communication Science at RTI International. We're glad to have Dr. Hood. I had the pleasure of meeting Dr. Hood as a postdoc at the University of North Carolina, Chapel Hill. Dr. Hood, welcome, and please take it away.
Okay, thank you so much. As Al mentioned, my name is Dr. Sula Hood. I'm a senior research scientist at RTI International, and I'm also the co-lead for the All of Us Researcher Academy, along with my colleague, Dr. Brian Southwell. Before I start getting a little bit into the actual academy, just want to talk about how excited I am to be a part of this work. I've been surrounded by the greatness of HBCUs my entire life. Have a lot of family members that are proud graduates of HBCUs, and also my parents are graduates of HBCUs. They graduated from Mississippi Valley University, Mississippi State. So I am also, while I didn't graduate from an HBCU, I did my post-bac research at Meharry Medical College, a one-year fellowship where I was on site at Meharry. And that was my first time really being immersed in the environment of people who look like me, who are scientists, people who are the same age as myself, people who are African-American and in leadership roles. My mentor was Dr. Evangeline Motley, who is a dean now at Meharry, and she's been a long-term mentor ever since. And so I'm really excited to be a part of playing a role in the development of the All of Us Researcher Academy. So thank you so much. Next slide, please. Okay, so I just want to acknowledge the organizations that we're partnering with. Of course, we're partnering with Community Campus Partnerships for Health, as well as NC Tracks Institute. We also are having some great conversations with other organizations that are a part of the consortium, including the Black Greek Letter Consortium, Pyxis Partners, the DRC at Vanderbilt as well, just to name a few. Next slide, please. Okay, so I just want to acknowledge and call out our awesome team within RTI. I'm up in the top left, and as I mentioned, I'm a co-lead with my colleague, Dr. Brian Southwell. We also have Demarius Davis, Ife Adewumi, as well as Sherry Cates. And I won't name them all. We just have so many great colleagues on our team. And we're really proud to have several of our team members who have HBCU alumni and affiliation ties, including Meharry Medical College, North Carolina A&T, North Carolina Central, as well as Winston-Salem State University. Next slide, please. Okay, so now I just want to delve for the next few minutes into talking about the All of Us Researcher Academy, which is why we're here today. I want to really get you excited about all that it has to offer and why it's so important. The goal of the Researcher Academy is to establish a diverse learning network of researchers who can use the All of Us data. And the purpose is really to promote equitable access to and utilization of this researcher workbench by a diverse array of researchers, including investigators from historically Black colleges and universities. So I want to talk a little bit about our initial objectives and what we are aiming to do as a part of this Researcher Academy in support of HBCU researchers. We will engage with HBCUs and HMSIs to raise awareness and assess needs. One of the things that is very important is for researchers at HBCUs to even know that all of us exist and what it is, as well as that the researcher workbench exists as a resource for them in their research, and also to understand and assess the unique needs that HBCU-based researchers may have, and think about how we might be able to work with them to address those needs. We will create internships and fellowships for HBCU students and faculty members. We're also going to curate a training curriculum that is focused on the skills that is needed to access the researcher workbench, as well as conduct research within the All of Us researcher workbench. Additionally, on top of providing support to faculty, students, and fellows as researchers of HBCUs, we also want to support the organizations. And so we are taking a multi-level approach to how we are delivering the academy. One component that we're very intentional about is ensuring that we provide technical assistance for our HBCUs and HMSIs to establish what are called DURAs. And these are research agreements that are needed to be in place at the institutions before the affiliated researchers can access and utilize those data. And we also want to build partnerships with other similar programs that are in place to support HBCU and minority researchers, so that we can draw some insights that will be able to support scholars. And then we are going to be doing a very intense ongoing evaluation of all of the various different components, so that we can really track what is working and understand how we might improve things to better support HBCU researchers. Next slide, please. Okay, so I mentioned that we're curating a comprehensive curriculum for Academy participants. And this is a working list. It's not exhaustive. I encourage you, if there are any topics that potentially might be missing that you think are important for us to include and cover as a part of the Academy, I encourage you to please enter those into the chat, or we'll have our email information available. But our tuition-free course offerings and learning resources that we're going to be providing to HBCU researchers will cover a broad range of topics, including how to access and utilize the researcher workbench. We'll have various different offerings on research study design, data analysis, and management. Also, we'll have some course offerings and resources related to how to effectively disseminate your research findings through conference proceedings or through peer-reviewed publications. We also want to support people in the next phase of their research. And so we'll have some things that cover how to secure external funding. One of the things I'm really proud of that we have baked into this academy is the importance of self-care for researchers. As researchers, we often look at these types of variables and risk factors from a research perspective, but it's important for us to think about how we can best take care of ourselves so that we can continue doing this important work. And finally, we will also include some research partnership and considerations. We know that there is no team of one. And so we are encouraging the importance of establishing partnerships with other researchers within the academy as well as externally. And we also want to provide some guidance to educators about how they can extend the platform to their students so that we can continue to get more and more students at HBCUs involved in the researcher workbench. Next slide, please. Okay, so we really want to also curate an engaging all of us Researcher Academy experience. And so we're really committed to fostering this supportive experience by encouraging network building and collaborations among Academy participants and promoting the importance of team science. As I mentioned, we know that there's no team of one. And so one of the pieces that I'm really excited about is the opportunity for encouraging scholars that are part of the academy to identify other individuals who share their similar interests within the academy. And maybe they might work together on a project or an analysis and have papers together or write grants together based on their work that they're doing as a part of the researcher workbench. We also really want to celebrate the accomplishments and the milestones and the successes of our academy researchers. And so we will be featuring researcher spotlights via our digital newsletter that we're going to create, as well as a website. And so this is an opportunity to showcase things like their research projects that they're conducting with the All of Us data and to announce their achievements. We also want to hold convenings related to topics that are unique to researchers that are based at HBCUs and that are from historically underrepresented groups and cover topics such as overcoming imposter syndrome and acknowledging and addressing experiences such as microaggressions and micro invalidations to really support them and let them know that they belong as a part of the larger scientific community. Next slide. As I mentioned previously, in addition to directly supporting the researchers, we also want to provide institutional and organizational support in the way of assisting organizations with securing their data use and registration agreements, which is DURAs, and offering consultations on the capacity of how to use researcher workbenches. And so not all institutions have DURAs in place yet. So we want to be able to support institutions that don't have DURAs with establishing them so that their students and faculties and fellow members will be able to access that data. Next slide. Next slide, please. Thank you. I've mentioned support a lot in these last few minutes, and it's very important that the mentors that are going to be delivering instruction or directly working with our faculty members and students, that they have experience in anti-racism training. The importance of inclusivity in science. We want people to be treated well, and we want the people who are going to be working with them to know how to treat them and treat them in an inclusive manner. And so our mentors will be asked to make a multi-year commitment to mentees so that they can really support them and work with them. We know that research takes time and that the projects build upon one another. And so we want to make sure that our scholars are supported. Next slide, please. Okay, so I just want to mention some of our current researcher academy activities. We are in the early stage of just starting things out, but we are on a roll. We have established a relationship with the University of Michigan, ICPSR, and they are offering a wearables course. And this is important because wearables data is available within the All of Us Researcher Workbench. And so we have established an opportunity for us to cover tuition for multiple HBCU researchers. And we've had several people sign up, and that'll be taking place in July this summer here next month. And then we're also actively conducting outreach and listening sessions to learn about the research-related needs of investigators and students at HBCUs so that it can inform our offerings within the academy. And then we're also currently doing curriculum planning and instructional hiring for the fall. Next slide. Okay, so I just want to announce a few upcoming opportunities to connect with the Researcher Academy and really encourage you to reach out. We are seeking prospective scholars or participants of the Researcher Academy. So we have the wearables course that's going to be offered in July. However, the University of Michigan actually has created a separate section of this wearables course that is specifically going to be dedicated to researchers and scholars at HBCUs. And that will take place in September. And so we are seeking individuals to sign up to participate if they have an interest in wearables. And so encourage you to maybe take advantage of that. We also will be offering a introductory course in R and using R to analyze the data within the All of Us Researcher Workbench. There are specific types of data software that are used, and R and Python specifically are utilized. And so we want to make sure that researchers from HBCUs know how to utilize this program. And so we will have an introductory course from two of our internal RTI colleagues starting in October. So it'll take place about mid-October. And then finally, I know I mentioned all of those various different topics that we're going to be covering. And once again, encourage you to suggest other topics if they weren't on the list. But we are actively recruiting prospective instructors to lead courses and learning activities. And these can be delivered in a variety of formats, such as webinars or virtual or in-person short courses, or asynchronous or live courses, or concentrated sprints or workshops. And so I really encourage you to take advantage of these opportunities, and we look forward to partnering with you. Okay, next slide. Okay, so we want to hear from you. As I mentioned, if you have any course offerings or topics to cover, any potential learning activities, we want to be creative and engaging. And so if you have any ideas for how we can engage people, especially virtually, or if you're interested in becoming a Researcher Academy scholar or instructor, please feel free to put your information in the chat, or contact us directly at allofus_academy@rti.org. Thank you so much.
Thank you, Sula. Thank you so much. We're so glad. I'm excited about the opportunities that you've shared with us, and we want to encourage people to use the chat box to just share any questions. We have questions that are already being curated, and so we're glad for that. I want to introduce our next speaker. In planning this session, we wanted to give some intentionality, not just hearing the voices from CCPH and RTI International, but also individuals who are doing research in real time. And so I'm really excited this afternoon to introduce one of those speakers, and I'll just cue up her introduction. Our next speaker is Dr. She's a graduating doctoral student, so we're going to call that Dr. Tanika Seminole Williams, and she is with the Neuroscience Institute at the Morehouse School of Medicine under the supervision of Dr. Robert Miller. I want to just share with you briefly that she has worked in basic science research since 2015 and in translational and clinical research since 2019. Her lab acquires stroke patient peripheral blood with consent for sequencing and analysis. Her lab specializes in RNA sequencing, followed by analysis approaches using bioinformatics and machine learning techniques. Tanika, we're glad to have you. And we want you to feel welcome this afternoon to share your research and your experiences with all of us, but also more broadly in the field of research. Thank you.
Thank you. Can everyone hear me?
Yes, we can hear you. We can hear you. Welcome.
Thank you so much. After hearing Sula talk about all of the possibilities of the Academy, I'm even more excited to be a part of this. I really am, especially being that I'm just a student. Thank everyone so much for inviting me. So today my talk will be about finding and using secondary data sets. Here's a little bit about what we'll be talking about. Current research, secondary data sets, specifically about the All of Us data set, the application and utility, along with mentioning some analysis tools, some pros versus cons of using secondary data sets, how to access secondary data sets, and the importance of applying the All of Us data set to our specific investigational questions. So I'll tell you a little bit about my research. As Alan mentioned, we do use blood samples from patients who have recently experienced a stroke for RNA profiling using RNA sequencing and bioinformatics. Now with this, we are aiming to discriminate between the clinical diagnosis of acute ischemic stroke versus hemorrhagic stroke. And our study design involves approaching patients in real time at the hospital, in the emergency room of Grady Memorial Hospital, and asking them basically, hey, we're collecting your blood. Would you like to be a part of our study? Of course, we go into details of what we're going to do with their blood as far as the sequencing and the data collection, because of course, we want to abide by all of the rules according to the government and our institution standards. But this is similar to the All of Us study as far as the data that we collect, and I'll show that in an upcoming slide. So some of our expected outcomes for our research involves just discovering a specific RNA expression profile that'll allow us to make that diagnosis between hemorrhagic versus ischemic stroke, because that will aid in decision-making for therapeutics. A secondary outcome is also to identify the subtypes of ischemic stroke to aid in that diagnosis and prognosis, to get a better treatment methodology and prognosis view of our individual patients. So moving forward, here is just a little schematic of some of the components that we collect. Not only are we acquiring biological samples from our participants, but we're also capturing data, clinical data, medical information, physical examination and laboratory data, neurological findings, and patient demographics. Now, this is similar to what the All of Us study captures, but the All of Us study goes a little bit further in their questions and their different surveys, and they're capturing data specifically from one source, which is mainly the participant, and that participant actually has access to their own data, which I find to be very revolutionary in a sense that it establishes a level of trust between the researchers and the actual participants in the All of Us study. So what are some of the sources of the secondary data sets? The main source, of course, is the NIH, more specifically the NCBI. They have repositories. Each institute, if you're not aware, within the NIH has its own repository with data. It all depends on what type of data you are as a researcher or a student looking to have access to. There are hospital medical records you could get secondary data sets from, and institutional databases. Once you identify your source, you would want to say, okay, how would I apply this data set? I'm interested in using secondary data sets. What are some of the applications? precision medicine studies, which I believe and know firmly that all of us study, will be able to revolutionize the advancement in precision medicine studies. Comparative analysis, improve currently existing therapies, drugs that are already on the market, already being used to treat patients. We could perhaps improve upon those treatment methods. You could use it to evaluate drug outcome and disease pathophysiologies in minority populations as well. Well, what are some analysis tools? As Shula mentioned earlier about the introductory to our course, your analysis tool that you choose will ultimately depend on your working hypothesis, your research question. What are you seeking to answer by using the secondary data sets? And it also depends on your original data structure. Being that, for example, using hospital medical records, which we call electronic health records, EHR, sometimes the data can be very unstructured versus structured, meaning you have actual data elements, versus unstructured, it's just data that's located within a summary in the electronic health record. And what that will require is you to use a combination of tools like R, SQL, Python, Tableau, SPSS, and so forth and so on. So it would help if you not only had some background or foundation in R, but also a couple of other software tools that allow you to make your analysis more robust and relevant and effective in you answering your specific investigational questions. But what are the pros and the cons of using secondary data sets? While there are cons, the pros far outweigh the cons. And you can always circumnavigate those cons. So some of the pros are the cost effectiveness of using secondary data sets, reduced volume, level of professionalism, the unobtrusiveness of using secondary data, type of data, scientific breakthroughs that goes hand in hand with enhancing precision medicine, and data permanence. Using secondary data sets allows you to realize that there is certain credibility to this data set since it has been used before and has been deposited into a reliable storage database. Some of the cons could be data quality, because you are probably the second or third individual acquiring access to this data. It may be not as homogeneous as you would like it to be, meaning you may have to tease to get out the relevant bits of data that you want and sort of piece it together in order so that you can feed it into whatever analysis tool that you're looking to use to answer your question. The data may be, there may be some irrelevant data, some exaggerated data, or some outdated data, information within your data. But you can always circumnavigate that by not only knowing specifically what type of data you're looking to access, but by also having the right collaborators that can help guide you to knowing what tools you need and knowing what data you need for those tools to be maximized to answer your research questions. How do we access this secondary data sets? Again, as I mentioned before, it depends on your research question. What are you hoping to answer? What are you hoping to improve upon in the scientific community? What type of data is needed to answer your specific question? Where's the data stored? And what are the requirements for accessing the actual data that you're looking for? Most of the time when you're accessing secondary data, because it can be patient health information included in that, you're going to need to follow the regulatory papers such as the IRB, the ROC, those different protocol papers, so that it verifies that you are who you are, you're going to use the data for what you say you're going to use it for, and there will be no data leakage. So we've been talking about the All of Us data, which is the main theme behind this webinar. Well, how do we specifically get access to the All of Us data? There are 6 steps roughly. Of course, you want to learn about the data. You want to check for your institute's agreement with the ability to access this data. You're specifically, as a researcher, going to create a researcher Workbench account. You're going to verify your identity, because once again, we have to make sure all the necessary paperwork is on file and you are who you say you are, and that there are ethical and moral and integrity behind the access and utilization of this data. you're going to complete an All of Us research training, and you're going to sign the Data User Code of Conduct. And to the right, what you see is the researchallofus.org website link, so that if you're interested in accessing the All of Us data, you can register. It is very simple and is very beneficial to research and moving research forward, specifically in minority communities. And I'll give a personal testimony of why I think accessing the All of Us data is important. Even though I'm a student, I'm a researcher in training, I've personally been a part of clinical studies such as the All of Us. And I feel a sense of not necessarily just pride, but like importance towards me as an individual when people are explaining their study to me and they're inviting me to participate in their study. And also with my data, I feel like it is protected. There's integrity and there are ethics behind everything that is done in these research studies. So that's why being a part of this webinar, being a part of clinical studies overall in general as a scientist, as an individual, is very, very, very important, because we want to ultimately make treatments more available, more accessible, and more effective in minority populations specifically. And with that being said, I'd like to just take this time out to acknowledge the Mello Lab at Morehouse School of Medicine, the Neurology and Asset Team at Grady Memorial Hospital, the RTI, their team. Thank you so much, Dr. Brian Saltwell, for inviting me. Shula Hood, thank you both. Everyone who's been working with me and inviting me to this webinar, I feel greatly honored. Thank you, CCPH, Al Richmond, Courtney Richardson, Virginia Hunter. I just want to say thanks to everyone for inviting me and giving me the privilege to speak about my research and to be included in the All of Us Data Research Program webinar. Thank you.
Thank you. Thank you for being with us and for sharing in detail your experiences, your personal experiences and professional experiences. Our next speaker is Dr. Debra Murray, and I want to bring her opening slide up. I met Dr. Murray a few weeks back, and we're glad to have her. Dr. Murray is at Baylor University, but she also acknowledges that she's a proud alumni of Prairie View A&M, and that she's a leader in diversity and inclusion, mentoring, and research education. She is a 2021 recipient of the Norton Rose Fulbright Faculty Excellence Award in Educational Leadership. Dr. Murray recently was awarded the All of Us Evenings with Genetics Research Program from the NIH All of Us Research Program. Dr. Murray is Director of Education, Diversity, and Initiatives in the Human Genome Sequencing Center, and as an assistant professor in the Molecular and Human Genetics Department and co-director of the Office of Community Engagement and Diversity at Baylor College of Medicine. Welcome, Dr. Murray. Welcome, Prairie View A&M University alumni. Dr. Murray.
Well, thank you so much, and thank you for inviting me, the RTI and the CCPH teams. So I'm happy to be here and see all the other excited HBCU faculty and alumni. So I'll get started. Do you want me to share my slides?
Yes, please share yours. You can drive. We'll put you in the driver's seat here today.
All right. Here we go. All right, so I'll tell you a little bit about our All of Us Evenings with Genetics Research Program toward the end, but I'll first do what I was asked to do, and then we'll get there. I bring you greetings from Houston, Texas. We are at Baylor College of Medicine. We're located in the Texas Medical Center. We're right across the street from Rice University, and we are not in Waco. And most people have us having a basketball team when the men and the women are winning. And anyway, that's not who we are. Today, I want to give you a snapshot of the hurdles that we still have to overcome in research And then I'll tell you a little bit about our program as well. And so there is still underrepresentation in research and data in the groups who are doing research. And we have to focus efforts on all these different levels so that we have groups who care about data about themselves and their community, and so that we can grow other researchers, i.e. the younger students who have an interest, but we have to help them through the process so they too can become whatever they want. If they want a PhD, MD, PhD, and or on the clinical side, but still conduct research. And so the problem persists, and there are many avenues by which the solutions are taking place. But I think we can turn all of us into one of those solutions. We are here talking about the All of Us research platform because it is an important data set that can be used by anyone, especially anyone in the US, if you're associated with a university. And we are interested in getting more underrepresented groups interested in knowing about this data and using this data, because we really need that perspective on the data itself and how to use it to increase our knowledge and address some of the issues that are out there. And I'm not going to go through these steps. You know that I want to get here. And so we are introducing you to this All of Us program that could actually help us solve problems. We have a lot of problems. We have missing data, and especially on the genomics side. This is a study here, genomics is spelling, genomics is spelling on diversity, that was done to repeat a study that was done in 2009. In 2009, a different group did genome-wide associations, and what they did was they scanned thousands of genomes to find variants associated with disease traits. And that study generated information that shows us that 96% of participants in all of these genome-wide association studies were of European descent. And so Popejoy and Fullerton did another study in 2016, and this is the data. It's one of the figures, I think, that tells us the information we really are looking for here. So in 2009, 96% of the GWAS studies were European, 96%. But in the more recent scan, they see that 81% are of European ancestry. So there's improvement, but unfortunately the improvement came in the area of the Asian ancestry. So there were more Asian ancestry studies that were done, but the other groups, the underrepresented groups, didn't really change much. And so we are at a disadvantage in being able to make concrete solutions because the data is missing. There was a study done out of Rick Kittle's lab that looked at the cell lines. So since there are such a few cell lines that study these groups, African Americans, Hispanic and Latino groups, and Native Americans, they wanted to characterize the ancestry of the cell lines. And unfortunately, they found that there was a lot of variance in the African American cell lines. And they identified a couple cell lines that were totally misclassified. And then this bottom slide here is taken from Dr. Fatima Jackson, who fabulous. If you've never heard of, please look her up on the internet. She has some talks, and actually on one of our, she did one of our Evenings with Genetics, Race and Genomics talks. And this is a genomic profile of an African-American woman whose data indicates that there is about 64% of her genome that's missing. So either these particular regions are in the DNA have not been assigned to a region of origin, or the data is simply missing. So 64%. Now, a large percentage of her genome is European. At least the data is available to tell us that she has, what is that, 20% European, and I think there was a smaller percentage here, and then 15 or so percentage of sub-Saharan Africa. And I think one of the quotes that Dr. Jackson made was, all of this is done in the backdrop where Africa is the seat of civilization, and we have missing data from that particular content that is rich with information that could help inform all of this information that isn't present for our really ongoing studies in future for identifying drug disease targets, all of the types of conditions that are out there that might have some kind of explanation that is non-invasive or doesn't require going and taking pills and those type things. But we don't know. We don't have any idea about how to approach that yet. So the All of Us database that you've already heard a lot about is really important because it is the first database that has a large number of participants from these groups that are missing in this data. And we see there are 45% currently who self-identify as racial and ethnic minorities. And Dr. Watson just told you they hit the 500,000 mark with participants. And 80% of the communities that are represented from the biomedical research also are representative of these groups that are missing data. And so we are excited that this information is available and virtually almost at your fingertips. We know there are some steps that you have to get to, but it's there for you to utilize and work with. So the other thing I was asked to talk about was mentoring. We know it's important, and what you have to do is identify what type of mentor is best for you. You can have more than one or two, but if you need some assistance and some help, these mentors are available for you. And there's just a specific way by which you go and get help. If you don't have a mentor, then you ask them, you meet them at conferences, and you ask for the time, but be specific about what your request is. And I know I'm already almost at my 10 minutes. So All of Us Evenings with Genetics research program, we work with HBCU and Hispanic serving institutions to introduce the faculty to the Workbench and also help them to introduce their students to research careers. So when we work with a campus, the campus will have a seminar where the faculty from the seminar, and this is the one we did with Prairie View back in April. So we had 3 faculty who gave us a talk and told the audience about their research, and they brought their students who also had an opportunity to share. And we also did a town hall with the undergraduates so that they could hear from students around the country. And these were graduate students around the country. They get a chance to spend a breakout session and learn about the different career choices. And we also are interested in helping early career faculty to access this research hub. And we do that by having a summit. And we had our first summit in May. We had 34 scholars that showed up, and they develop research teams, and these are the titles of their projects that they are utilizing the bench, the research bench data in order to carry out these projects. So I want to just give you some of our information. You can find out more on our website, and please go to the All of Us database and just look around, and you can use our alias URL here so that we know that you visited on our behalf. And I think we're doing questions at the end, but thank you.
Dr. Murray, thank you for that highly engaging session. I think you answered so many questions in your presentation. In particular, a lot of people have been asking the question about how would you tailor this specifically for their institution? And that one slide that talked about the work that you all are doing at Prairie View really shares with all of us an example of how each of the institutions on the call today will be able to tailor something similar for their institution as well. So I really want to appreciate that. We may be running behind time, but that's okay. We want you to hang in there, stay with us, people, stay with us, because we want to answer some of the questions that you have been asking. And so we've got our presenters are still here, and Javon Carter in particular, Javon makes a comment about that he's one of the R instructors that will be giving the October course, and he wants to hear from you to help grow the course so it can reach everyone. So please reach out to Javon as well. I think a lot of the questions have been answered. So Cynthia Glenn Cotton asked the question, have you considered partnering with computer science students at the schools to help bridge the R and Python knowledge gaps with the researchers? Would any of our presenters, Sula, Brian, others would want to take that question in terms of partnering with computer science students?
Sure, I'll respond. I think that is a great idea. This is why we're encouraging everyone to discuss, your thoughts in the chat. That's not an idea that we have thought about, but I think it would leverage the existing skills and assets that are already at the institutions. And so we will definitely take that into consideration. And I also do want to mention that as a part of this work with getting things up to speed from a computational perspective, we are having some conversations and developing partnerships with some groups that are focused on things like computational analysis, data security as well. So we have it on our brain to think about those things, but I really, really like that idea, because I'm all about leveraging the existing skills and creating those partnerships internally as well. Thank you for that.
Thank you, Dr. Hood. Dr. Murray, I'm going to pitch this question to you because you've already described some of this about what you're doing. Is how do you recommend pitching or sharing this research program with campus leadership? This individual says that they are in the Division of Student Affairs, and that usually it's the academic affairs that would take a lead on this type of project. And we'd just love to hear your thoughts about how to pitch this to their institution.
Yeah. Actually, she's right. You would have to go on to the academic affairs side and get to the individual in the Office of Research, probably. And I would say too, one challenge we have, because genetics is in everything we do, but we are encouraging faculty from all disciplines. So in health education, psychology, sociology, all across the university campus are able to find data on this database and utilize it for their research purposes. And so it's a long haul, I will say. I mean, we have a hard time just knocking on the right door and getting into the right room, but someone who's already on campus and is excited about it, then I would say get to your research official VP of research or the provost, because some campuses it is a different individual, and invite us up so we can share with them how they can get the rest of their faculty involved in doing all of us research.
Dr. Murray, your question and your response earlier made me think about also the fact that being on the webinar today really is a first step for some in terms of creating a community of practice. You mentioned mentoring, right? And so we can mentor each other. And so please make sure we have your contact information for all of you who have registered today. Follow up with us, and we'll be reaching out to you. I'd like to close. We have a poll that we want to take a moment to actually to share with you. But before that, because Dr. Watson is going live, Dr. Watson, any closing comments from your perspective in terms of the webinar today, but also about connecting with the All of Us project?
Thank you so much, Al. This just warms my heart to see this conversation happening today. But I also want to encourage, if anyone on there talking to that question about leadership is so important, and we will actually be working with Al. This makes me think we need to have a different conversation about how do we develop a presentation for the leadership, because if you're talking to your leadership, also talk to them about how secondary data sets like the All of Us data and even other secondary can actually help promote research grant development within your institutions. This is a powerful tool that can be used to support grant applications from institutions that can advance the number of research awards that you receive, whether it be from NIH funding or other institutions. So please, we'll be working with RTI and CCPH to think about how we can communicate the benefit of this type of database to the research leadership within the Office of Vice Provost of Research and other places. So thank you, Al.
Thank you. So as we close today, we have a link, I believe, to the poll. And so we're asking you to follow that link and to respond to the questions there. So the first question was, how would you describe your knowledge level about All of Us? This is just kind of like a post survey. Very knowledgeable, somewhat knowledgeable, a little knowledgeable to no knowledge. We're giving you a minute there to respond. And then the second question is, having attended this webinar, how would you now describe your knowledge on the All of Us Research Academy project as well? So we have pre and post. All right. That's great. So we've increased there. So we have met our goal today. We're excited that at least 56% of you said very knowledgeable about All of Us, and that's our intent today. So thank you for participating today. Thank you for joining us. Stay tuned for future webinars. A lot of ideas have surfaced today regarding how to promote this with leadership, how to promote this among faculty, but also the engagement of students. I want to thank all of our presenters today for taking the time out to join us, and thank you for joining us. Stay tuned and find out more information about community campus partnerships for health by joining us at our website at ccphealth.org. Please sign up for our newsletter, which will provide you with current and up-to-date information about the work and activities of CCPH. Thank you, and thank you to our RTI partners, to Dr. Watson and others for joining us this afternoon. Thank you. Bye-bye.